it matters very much because at the core of the negotiations is a question of whether the PAP system will be designed around equity and public health or around commercial interest and profit for some developed countries. I think this is the core of the negotiations, right? And if we have an inequitable PAP system, what we are going to face is a situation where countries are going to be very reluctant to participate and very reluctant to share the pathogen material and sequence information. So we will not be able to know what is circulating and be prepared.
Welcome to the Global Public Health Revolution, the podcast by the AIDS Healthcare Foundation, where global public health meets bold advocacy and game-changing marketing to spark real change. It wasn't too long ago that COVID-19 brought the world to a standstill and left in its trail economic hardship and grave human cost. But that was not all. During the pandemic, there was also gross inequity in terms of access to vaccines, as many countries, particularly from the global south, had to wait last in line to get vaccines for their citizens. And it made the world start to rethink how it responds to pandemics, public health emergencies in a way that is equitable and fair for all, regardless of who or where they are. We saw cases of developed countries hoarding vaccines. And that led the world to begin a process called the Pandemic Agreement, finding a new way or a better way to make sure that the world can respond to the next pandemic or even public health emergencies in ways that allow not only the global north, but the global south access vaccines, diagnostics, and therapeutics when they need it. Now, the Pandemic Agreement was adopted in 2025, which was a historical milestone. But one critical piece of it remained, and that is the pathogens access and benefits sharing, otherwise known as the PABS Annex. Today, negotiations have continued around the PABS Annex, but there are challenges, contentions on what should be binding and what should not, who should have access to data and how. What about the involvement of civil society in critical processes such as this? Is the world really ready for when the next pandemic hits? Not if, because it will happen. And advocates around the world, such as the Third World Network, the AIDS Healthcare Foundation, the Resilience Action Network International, have all been coming together to call for an equitable PABS Annex. And I have the honor of hosting a guest today who is no stranger to this discussion. And part of what we'll be talking about is what are the equity concerns that remain with respect to the PABS Annex? What are the contentions that we're seeing on particular texts? What are we doing as the world in general, the global north and the global south, to make sure that the vaccine appetite that happened during COVID never happens again? And I'm very happy to be joined by Sangeeta Shashikant. It's so good to have you on the podcast today to discuss this very important topic before the next negotiations begin on the PABS Annex. Thank you for joining me.
Thank you very much for having me.
Okay, so you are from the Third World Network, and you've been doing a number of work around PABS. And I just wanted to highlight here that just for the benefit of listeners who may not know what the PABS Annex is. Now, the PABS Annex establishes rules for sharing pathogen samples and genetic data used to develop vaccines, therapeutics, and diagnostics, and how the resulting benefits from the use of the system are shared in return, right? And one thing that we're seeing is that time is actually running out because we're supposed to have the final rounds of the PABS Annex negotiation at the end of the month of March. And failure to reach an agreement could force a weakened compromise or delayed pandemic agreement ratification. So just to help us unpack, can you take us through the journey from the pandemic agreement to where we are today now with the PABS annex?
So, as you mentioned, during COVID-19, we saw staggering inequity, right, between the developed countries, the rich countries who had very rapid access to the vaccines, therapeutics, diagnostics, right? We talk about vaccines, but even the monoclonal antibodies, which were all available in the developed countries, were not available in developing countries, although they were recommended by WHO. So there was really vast, staggering inequity in a global crisis when we should have come together to address a global issue. And as you mentioned, developing countries were at the back of the queue waiting for supplies. Some countries never got supplies until the end of 2022, right? Like at the end of the COVID-19 pandemic. So now when COVID hit in 2020, developing countries, because of the impact that we saw on lives in the WTO and the fact that developing countries did not have supplies, in the World Trade Organizations, a group of developing countries actually came together to call for the waiver of intellectual property rules so that the barriers to production can be removed, so that production can be diversified, supplies can be expanded, and all countries that need it can have access. But even this move was actually objected to by the developed countries, particularly the United States and the European Union. The United States eventually came to agree to part of it, but the European Union was against it. So we had staggering inequity. There was also opposition to having any kind of concrete measures to address the problem of heavy concentration in seats in the pharmaceutical industry, right? So it was a very heavily concentrated industry and so that became a problem when we wanted to diversify production quickly and expand supplies. Now, all of this led to, in 2020, the European Union calling for a treaty on pandemics, right? And I guess they were feeling the heat from the opposition that their opposition to the what we call the TRIPS waiver measure that developing countries were pushing in the World Trade Organization, and they were facing a lot of heat because of the lack of solidarity that they were showing at the international level. So they called for this international treaty on pandemics in 2020, and then eventually the EU and the Director General of WHO called together, proposed a new treaty on pandemic preparedness and response, and a few world leaders came together on this. Now, on the face of it, when the negotiations start, it became very clear very quickly that they only wanted the developed countries to show solidarity in name. When it comes to concrete measures in the pandemic agreement, concrete measures taking on obligations to support developing countries to diversify production by transferring technology, concrete measures, when they give public funds for R&D to make sure that there are conditions attached to it so that, supplies can be guaranteed, in terms of access and affordability. So they were against concrete guarantees. Instead, they were actually seeking for commitments for all countries to share pathogen samples and sequence information, right? So they wanted to have put on obligations, but they did not want to take on commitments to give equity. So developing countries wanted, on the other hand, to see concrete measures so that equity can be delivered in times of a health emergency. And so building on the experience that we have in the WHO in the context of the pandemic influenza preparedness framework, which is also about sharing of influenza viruses of pandemic potential and benefit sharing, the developing countries, especially the Africa group, proposed for a similar system in relation to pathogens with pandemic potential, that the sharing of pathogen samples, samples of pathogens with pandemic potential will be accompanied with fair and equitable benefit sharing. And they had made proposals, and there was hope that this mechanism would be established in the context of the pandemic agreement. Eventually, because of the time constraints in the pandemic agreement, because the pandemic agreement addresses many other issues, they agreed on one article called Article 12 that set out the parameters for the establishment of a pathogen access and benefit sharing system, which we now call the PAP system. And so the pandemic agreement was adopted The main part of the pandemic agreement was adopted in May 2025, but now the negotiations are ongoing with respect to the PAP system, which the PAP system is supposed to be in an annex to the pandemic agreement. And then ratification is supposed to open. We have had now 5 rounds of the Intergovernmental Working Group that has been engaged in the negotiations of the PAP system. And as you mentioned, at the end of March, we will be having the 6th round of negotiation. Now, the problem in this negotiation has become that the bureau which is in charge and set up to chair and manage the negotiations on the PAPS annex, the bureau comes up coming with a text that repeatedly eliminate proposals that developing countries have made. And these proposals are very important from the perspective of equity. And we see that the latest text that has come out this week has also disregarded and removed all the proposals of developing countries, and instead the text only accommodates the very unreasonable and unjustified demands of the European Union, which is also supported by the other developed countries. So this is where we are in the negotiations presently.
Thank you so much, Sangeeta, for taking us through that timeline, because what I hear you say is it looks like the world hasn't really learned anything from COVID-19. That's what it looks like. And the fact that developed countries are pushing back on fairness, particularly the European Union or some European powers, pushing back on the need for fairness and equity when it comes to, if I give you my samples, if I give you my pathogens and data, it is only right that I get an equitable benefit from it, whether it is in terms of the vaccines or the diagnostics or therapeutics or financial benefits, whatever it is. On the surface, that sounds like that should be a deal for everyone. But then there are also people who think that the issue of big pharma seems to have a play behind this. It's almost like a case of putting the pharmaceutical profits over lives, right? Over people, because that's what seems to be coming out even as we listen, to the discussions that are happening, and even what you've just shared. And it is very sad because the world needs to be truly ready when the next pandemic hits. And so I want to ask you, because you started speaking on it a bit, and it's the fact that why is the PABS annex critical? Why is it a critical piece of this agreement? And what are the concerns that are emanating now from this new intel that you're sharing with us and from observation?
So the PAP system, let me just explain what is the PAP system, right? The PAP system sets out rules for the sharing of pathogen material of pandemic potential, as well as the sequence information, which is the genetic blueprint of the pathogen, the RNA, the DNA, the proteins, which are very valuable. And the material and the sequence information are very important for the development of vaccines, therapeutics, and diagnostics, and are commercially valuable. If you remember, during COVID, in January 2020, once China shared the sequence information of COVID-19, companies very rapidly designed the vaccines. And during COVID-19, these companies made billions and billions of dollars in profit, right? So what we see is the pathogen material and the sequence information are very important for the development of life-saving tools, and they are commercially valuable.
Yeah.
And we have seen repeatedly, we speak a lot about COVID, but what we see in terms of health emergencies, whether it's Ebola, Mpox, when materials and sequences are used to develop vaccines, therapeutics, and diagnostics, right? Developing countries do not have timely access, affordable access to these products. And it was not just during COVID-19. We have seen this before COVID-19 during Ebola. We have seen it after COVID-19 with respect to Mpox. Affected developing countries, for instance, in Africa, that were very badly affected, just did not have access to the supplies that they needed to treat their population. So the PAP system, if we get it right, it can help to infuse some equity, improve timely access. Now, let me explain how. What the PAP system will do is that it will set up a framework where the materials and the sequences are shared, And the recipients that are receiving the materials and sequences should be entering into contracts with WHO to provide fair and equitable benefit sharing. So you might have, say, WHO designated laboratories. You will have entities using the materials and sequence information for commercial purposes. And part of this would be the manufacturers of vaccines, therapeutics, and diagnostics. You would have entities that are using the materials and sequence information for non-commercial purposes, such as academic institutions, right, that do a lot of the basic research on these diseases. So they will commit to providing fair and equitable benefit sharing. And, this can help to level the playing field in terms of improving pandemic preparedness and response. So it is a very critical part of the agreement for the pandemic agreement, because the pandemic agreement have got very general provisions. They are heavily caveated. They do not provide concrete commitments to improve access, to improve pandemic preparedness and response. There is no mention of guarantees of timely access. Now, this changes with this can change with the PAPS system. So if you see, one article in the pandemic agreement is Article 12.6. It already says that in the PAPS system, one of the benefit will be that during a pandemic emergency, the manufacturers commit to give a target of 20% of vaccines, therapeutics, and diagnostics for the pathogen causing the pandemic emergency, of which 10% will be provided free of charge to WHO, and the remaining 10% will be negotiated between the manufacturer and WHO based on the capacity of the manufacturer, and the remaining 10% would be at affordable prices. Now, what this does is it puts WHO at the front of the queue with other rich countries, so that WHO, once they have the supplies, can provide to countries in need. This was something that was not available during COVID-19. Now, for this to happen, there has to be some basic elements that have to be in the PAPS system. And this is where I want to say that when we look at the latest text that has been presented by the Bureau of the negotiations, the latest text do not contain these basic elements. So let me just go through some of these basic elements. The first element is there has to be a contractual relationship with all the recipients of the PAPS material and sequence information. The pandemic agreement is a treaty. Treaty is only binding on states. It does not bind the what do you call
Like the commercial entities. And
that's right. It doesn't tie any of these non-governmental entities, right? Whether you're a company, whether you are a academic institutions. And so the contractual relationship where it is enforceable and it's in the form of a contract with WHO gives the commitment very, very clearly that this is, I'm getting access to the PAPS material and sequence information, and in exchange, this is what I have to share. So the contractual aspect is very important, and the text only addresses the contractual aspect partially, only in relation to manufacturers. It does not talk about does not apply the same contractual obligation on other recipients. And so that is a problem. Like I said, it does not reflect many of the proposals of developing countries. Now, the other problem is with the handling of sequence information. The text on the table permits the sharing of sequence information with databases that practice anonymous access, right? So when databases practice anonymous access, we do not know who the user is. The user cannot be identified. And if the user cannot be identified, then there is no way to enforce fair and equitable benefit sharing.
So there are challenges with traceability, being able to trace.
The challenge with traceability, because if you cannot identify the user, because the user has gotten it through anonymous access, there is no way to ensure compliance with the PAP system. And all of these entities that access the sequence information can evade the benefit sharing obligations. So that's another problem with the text that is put on the table. So the developing countries have proposed their proposals on it, that databases need to have user registration, they have to be verified, they have to commit upfront to terms and conditions that are required by the PAP system have been disregarded and removed. Now, we do not understand what is the problem with user registration, because we on a daily basis, all of us do user registration every day. When you want to access any social media, any website, and we accept different terms and conditions almost every day, right, online. So this this uh, this is an unjustified objection by the European Union because they do control the infrastructure on data. And so they want to ensure that, their entities, their researchers, their companies can continue with the status quo. So that is the problem. The other problem we face in the absence of user registration and, having contractual obligations applied to sequence information is that without this, we are creating significant biosecurity risk as well, right? We are sharing PAP sequence information anonymously, and this PAP sequence information is in relation to dangerous pathogens. Now, in the age of artificial intelligence, this can be easily weaponized, right? So it does not make logical sense to actually not to put in place certain safeguards and to ensure that we at the very least know entities that are accessing this sequence information. And then you have benefit sharing tax that is very weak. Developing countries have made several proposals on this. All right. As I mentioned, the pandemic agreement has got a provision about setting aside vaccines, therapeutics, and diagnostics during a pandemic emergency. But before a pandemic emergency is declared, there is always a situation called public health emergency of international concern, right? This is a legal terminology that WHO uses, right? This is the setting before it becomes a pandemic emergency. The
Yeah.
developing countries has said that one of the objectives of the pandemic agreement is prevention. So we need to make sure that the manufacturers also make available, guarantee WHO certain set-asides of real-time production during outbreaks and during this public health emergency of international concern. Because if we manage to control the emergency at this point, then it will not become a pandemic emergency, right? So it makes total sense from a public health perspective, but it is objected by developed countries and it has been removed from the text. This has been something that's been repeatedly proposed by developing countries, but it has not made it to the text. And another very important proposal by developing countries is that, there should be manufacturers should give pre-negotiated licenses to WHO because during an emergency, the demand increases suddenly and there isn't sufficient supply. So if you have license given out to manufacturers, production can be diversified immediately, supplies can be expanded immediately, right? Again, this has been objected to by developed countries. So if you look at the text that is on the table, I would say it fails the equity test that we need it to have for us to have a very effective PAP system.
Yeah. Thank you so much. And what's baffling with all of this is that for a long time, the EU has championed the idea of solidarity, right? And now is the time that the world needs it to stand behind that in terms of exemplifying it. It's not enough to say you champion solidarity and support, but, basically back your words with your action. And I think that's why these conversations are very important. But I just wanted to ask quickly, because even the whole discussion on the 80-20%, haven't there also been contentions around the fact that even 20% doesn't really cut it? If we look at the proportion of these health emergencies and the risk that it has even for global health security at the end of the day.
Of course, because developing countries make up 76% of the world population, right? So how can 20% be sufficient? And it's not even 20% that they're giving. They're actually only giving 10% free of charge. That's the only thing guaranteed. The other 10% is yet to be negotiated with manufacturers. So we have no guarantee of the remaining 10%. And so the majority of the world population, which is the developing world, will not have access. And so what is on the table is really a minimum. And even that is being objected to. And they're only willing to agree it in the pandemic emergency. But the pandemic emergency is once in a lifetime event. Whereas the public health emergency of international concern can happen every 2-3 years. We have already faced Ebola. We have already faced
Mpox,
Mpox.
Marburg. Yeah, they keep
So
coming.
So if we are dealing with a global crisis, which
Mm,
we should all be concerned with, it is
mm,
just logical for us to ensure that the supplies are there, the stockpiles are there. That
mhm,
is the very essence of preparedness and prevention, right? It makes no sense that only some countries that have entered into, and a lot of developed countries enter into advanced purchase agreements with companies, and so they know, like for instance, once mpox hits, they enter rapidly into these agreements with manufacturers so that their needs are prioritized. Although there may not be that many cases of mpox in their countries because they are
mm,
prepared just in case it were to reach their countries. Meanwhile, the countries that are affected and need it don't have access. Because these rich countries are also willing to pay premium prices
yeah.
for access to supply. We had that same problem with Ebola as well.
And when we talk about Ebola, Mpox, and the fact that even continents like Africa, for example, usually get hit the hardest with some of these emergencies, and even the global South in general. And we see that there's been such a ramp up or ramping up in the push for regional approaches. So even the calls for regional production and manufacturing, so that regions and continents are better prepared and are not overly dependent. Because we know that historically, when it comes to addressing public health emergencies, it's always been a top-down and centralized approach, which COVID has proven to us that that cannot work. So we're seeing an increment in the push for regional approaches. We're seeing, different regions, whether it's ASEAN, whether it's Africa CDC, the Gulf CDC, we're seeing that call for regional production and manufacturing. So it makes me wonder that how can this be fully realized, especially when we have critical pieces such as the PAB system in such heavy contention? And what I'm trying to ask here is, what would be the implication of an inequitable PAB system, not just for only global health security or equity, but even the full realization of regional production and manufacturing of vaccines, diagnostics, and therapeutics?
Yeah, so the PAP system can play a very important role in supporting regional production, in supporting timely access. And I mentioned that one of the very important benefits that developing countries are seeking is licenses to be given to manufacturers in developing countries, so that if there's only one manufacturer that has the rights to produce, and this manufacturer may not be able to supply uh, all the countries that are actually in need. And so it is very important for us to diversify production. And this is where that regional capacity for production kicks in. Right, I think this is very important. Of course, for regional production to happen, there has to be a political will at the
Yeah.
regional level, at the national level, to make it happen as well. So
Mm.
I think all these different aspects have a role to play. And the PAP system can contribute positively towards supporting regional production, especially during a health emergency. Now, what is the implication of an inequitable PAP system for global health security and for equity? So, when we talk of equity and we talk of an equitable PAP system, and the PAP system has been built on these principles, the principles of equal footing, where access to samples has to be treated equally with benefit sharing. So if we talk of rapid access to samples, there has to be rapid access to benefit sharing. So the equal footing principle is very important. The principle of transparency is very important to ensure that all aspects of the PAP system are handled transparency. Very important for there to be accountability, right, on the part of WHO in managing the PAP system, on the part of the recipients. If you're getting access to material and sequence information, you need to make those commitments, and the systems have to be in place for them to be able to make those commitments. User registration, contracts,
Mm.
all of this contributes towards accountability. And then legal certainty in the form of contracts. Article 12 of the pandemic agreement makes very clear that the terms and conditions on access and benefit sharing should be such that they provide legal certainty, right? So all of these principles are very important to achieve an equitable PAP system and to realize equity. Now, but we don't see that happening. And as I've explained, the text on the table is very weak on all of these fronts. Now, if we do not have these pillars, these are the pillars of a good PAP system. If you do not have these pillars established, good foundation, then what you really have is really a system that is enabling exploitation, misappropriation of shared resources, and this is what we call biopiracy, right? So you can be sharing resources, and if you see the language on intellectual property, it allows expensive appropriation through intellectual property. So, you are creating a system that enables exploitation and misappropriation, and which is what we call, as I mentioned, biopiracy, where the shared resources, are actually appropriated through the system, right? And this institutionalizes asymmetries between those that are providing the pathogen material and sequence information, and ultimately those who drive the commercial and technological benefits from them, right? It entrenches existing inequities rather than correcting them, right? So ultimately, it's undermining the entire credibility and function of the pandemic agreement. And so rather than global cooperation, actually, what we are creating is a system of imbalance. So, and I think finally, as I mentioned, what are the biosecurity risks associated with just sharing sequence informations, even materials, but I think more so in sequence information? What are the biosecurity risks we are going to be facing as a result of sharing anonymously sequence information of dangerous pathogens in the age of artificial intelligence? I think these are issues that are very important for us to address and properly, because it can actually create more global risk than resolve, the challenges that global public health is facing.
So you raise the issue of transparency and accountability, and I want to talk just very quickly on civil society, because that's one area that we're also seeing. Civil society is basically saying they're not being allowed into the room when these negotiations happen. And that is also concerning, because we all know that civil society played this dual role of both the technical expertise, but also the voices of communities. And in the end, when this gets ratified and approved and all that, it is civil society that takes it back to make sure that it is implemented on the ground, that the communities understand the benefits of it. Can you speak a bit more about the challenges we're seeing in terms of, civil society having access to the negotiations that are happening, and why that should be also prioritized and not to be sidelined as just bystanders who just maybe get the information after the fact?
Yeah, civil society have a very strong role to play in terms of reporting on what is happening, presenting analysis from relevant perspectives, also exposing some of the inequities that we see in the negotiation process. And I think when civil society are not given sufficient opportunities, because civil society are involved very much in terms of delivery of VTDs, they're very engaged with communities. They often know the true challenges that we face on the ground. They have a lot of practical and real empirical evidence as to, how certain things should be or should not be. So they play a very important role in bringing the evidence forth, right? So I think what we have seen in the negotiations, that civil society have not been given sufficient opportunities, credible opportunities to engage with the process. I think we are given like a few minutes of intervention in the entire process. In the course of 1 week, maybe we have 2 opportunities or 3 opportunities of a few minutes each, and so that doesn't allow us to engage sufficiently in the process. And of course, the whole transparency in the negotiations is an issue. Even transparency in how this text has come up. Like, why have the good proposals that have been made to advance equity just been dropped out, right? So transparency in the negotiations is critical if you are to have an equitable outcome, for sure. Yeah.
Okay, so let me put the spotlight a bit on TWN, the Third World Network. What have you been doing around this this whole issue, especially on the equity concerns we're seeing currently with PABs that you have laid out? If you could just share with us you and your partners, how on the advocacy front, what are you doing to ensure that the EU or the European powers that are pushing back on the demands of the developing countries can actually have a rethink and do the right thing?
So when we look at the PAPS is about operationalizing access and benefit sharing system for pathogens with pandemic potential at the international level. Now, when it comes to access and benefit sharing, we have to understand there are very clear established international rules on the rights countries have in terms of access and benefit sharing, the right to fair and equitable benefit sharing, the right to decide whether to give access to your biological resources, because under the Convention on Biological Diversity and the Nagoya Protocol, which established these rights, they are very clear. States have sovereign rights over their biological resources, and access depends on mutually agreed term with the provider country. Now, that is normally operationalized at the national level. Here, we are negotiating an instrument applying the same principles but at the international level. So, Third World Network has experience in engaging in these forums, in the Convention on Biological Diversity, in the Nagoya Protocol and access and benefit sharing. We have significant experience around access and benefit sharing. We also have a lot of experience and knowledge in terms of public health, addressing the issues around access, intellectual property, as well as we were very much involved and engaged in the negotiations on the pandemic influenza preparedness framework, which is an ABS system around influenza virus of pandemic potential. So, and in that, you know, following its adoption and implementation, WHO has now entered into several contracts with manufacturers, and they've secured about 700 million doses of vaccines, 15 million doses of antivirals. Now, that was very important because during the outbreak of H5N1 bird flu virus, there was again that same inequity that we saw in COVID-19, Ebola, Mpox, right? Now, that led to the negotiation of the PIP framework. So, we are very much involved in that process. So what TWN is Third World Network is trying to do is to use this experience in our different forums, different issues, because the issue of ABS and at least the PAPS brings about the issue of ABS, public health, access, affordability, intellectual property. And, we are trying to bring these issues together and to raise awareness in public, in civil society, and also amongst negotiators on the key elements that are important for us to have a reasonably equitable PAP system that is accountable, transparent, and that meets the objective that we are trying to achieve. And also importantly, the implications if we are not successful in doing so. I think we see this as our responsibility to create awareness, to put the evidence out there, and to bring others into this discussion, and to expose inconsistencies and problematic areas that can actually lead to an inequitable PAP system that is mostly about extraction. So we want to avoid that scene. Yeah.
Thank you very much. I just want to, for someone who is listening to us, and maybe it's not even their area of focus or but hearing, because at the end of the day, what happens with the PABs affects all of us, regardless of who or where we are or where we're from and what side of the divide or what side of the globe we reside in. It will impact all of us. So why should everyone care about this enough to rally behind it?
It matters very much because at the core of the negotiations is a question of whether the PAP system will be designed around equity and public health or around commercial interest and profit for some developed countries. I think this is the core of the negotiations, right? And if we have an inequitable PAP system, what we are going to face is a situation where countries are going to be very reluctant to participate and very reluctant to share the pathogen material and sequence information. So we will not be able to know what is circulating and be prepared. So that could be a challenge that we face. And if there is an inequitable PAP system, then we are going to face a situation where there's going to be inadequate access during a health emergency. And while we may have the PAP system that is supposed to address these challenges, But without access to vaccines, therapeutics, and diagnostics in a timely manner, diseases will spread very, very quickly, right? From an outbreak to a public health emergency of international concern, and then to a pandemic emergency. And we know from COVID-19 that no one is safe until everyone is safe. So once you have a disease spreading rapidly, it is very, very difficult to stop it. So the idea is to really have a PAP system that is more equitable. Now, when we look at pandemic, it is a global crisis. So it is in everyone's interest to stop an outbreak, health emergency, and to ensure it does not become a pandemic emergency. And I think what an equitable PAP system offers is a win-win situation for the international community to create a system that is fair and that allows us to be prepared for any health emergencies and to prevent such emergency becoming a pandemic emergency. So I think this is what we need. If it's done fairly, it can be a win-win situation for all parties. But if we just follow the unreasonable demands of the European Union, which is not rooted in any kind of evidence, then you're going to have an inequitable system that will only work for certain actors, might work for the companies, might work for the institutions in developed countries, but not for the developing countries. So then you will not have a system that works effectively.
I agree with you. And I just want to say thank you to the Third World Network and what you're doing around this issue, not just in the process, but is in the advocacy around ensuring that we get an equitable PAB system. The work you do is very valuable, and we do appreciate it, alongside other partners that are working on this. So I want to close and just ask you, what would be your call to action, particularly to the EU countries and even some of the European superpowers, because we also know that there are some countries outside of the EU who are also pushing back. And then also to the global south, the developing countries who are staying true to this to say it needs to be equitable. What would be your call to action to them?
So I think it is time for civil society, we are public health oriented, scientists, health professionals, and others. I think we have to expose the real agenda of negotiators and the real agenda of negotiators and the positions that they are taking from the European Union, Norway, Australia, Japan, Canada, Switzerland, United Kingdom. What is their true agenda?
And
It's
Germany,
namely,
right? Because Germany is also
and
one of
Germany,
those
yeah, it's
countries.
part
Yeah.
of EU, but Germany is at the very forefront of,
Yeah.
pushing the EU's position.
Mm.
And namely, their aim, the negotiators and the positions they're taken, their aim is to use WHO as a forum to access biological resources from developing countries for the benefit of their institutions and commercial entities. Their positions are not driven by public health. And it is very unfortunate, but that is the truth. So in effect, their aim is to turn WHO into a platform that legitimizes and perpetuates biopiracy.
Mm.
So I think we must not allow this to happen. We must, civil society, other stakeholders, I think we all need to engage with our constituencies, governments to address that current imbalance in the negotiations. I think this is very, very important. So whether you're from the global south, you're from the global north, I think at least from the global north, to engage with governments and to question and interrogate them whether this position that they are taking is really in their self-interest. Is it really in the interest of public health, right? As we mentioned, no one is safe until everyone is safe. So, is it credible to take this type of positions? Secondly, I think countries from the global south must remain united, firm in demanding a PAP system that is genuinely advances fairness, accountability, and public health, rather than one that entrenches existing inequities. I think if we look at the positions of developing countries, they are based on evidence, because a lot of proposals that developing countries are made, actually, they are already in operation in developed countries. So while they are in operation, for instance, like standard contracts when you share biological resources, it's all in operation in developed countries. They just do not want it applied in the PAP system. So we know our positions are rooted on evidence, and so we need to stand firm on them and united. And I think we have a duty not to compromise, because for us, what is at stake is a lot of lives in developing countries during health emergency. And we've already seen that happen in all the different emergencies that we have faced. And I think we should really use this as an opportunity to infuse more balance into the global system.
Yeah, and I just want to add my voice to that because we also hear that there's some European countries that are on the side of the global south in terms of, pushing for equity, countries such as Spain, Luxembourg, Belgium. And I think it's important to applaud them for that. And just a number of the
Yes.
global south countries too that are speaking strongly on this, like Malaysia, Brazil, Namibia, Indonesia, Thailand. Those are countries that we also want to applaud them because the more countries, Pakistan and other global south um, partners, because the more countries we have pushing for equity, the higher the chance that we would at least achieve equity. So thank you very much for calling that out because it's
Yeah.
important. And I like what you say when you say civil society, part of the role of civil society in this process is to expose what the contentions are and to educate communities and let people be aware of it. I think that's really, really important. You wanted to say something?
Yeah, I think I would like to also say that while we hear that some European countries are in support of Global South and equity
Mm,
and take a public health position, but this is not reflected in the EU's position. And
yeah.
so, while they may say this is not our position, but it is your position that the EU
Mm,
is reflecting internationally. So, you cannot wash your hands and say, oh, but we don't agree with that position. But you agree with that position by not objecting to that position that the European Union is taking, right? So,
mm,
therein lies the problem because the EU's position is not driven by public health consideration. It is not driven by wanting to show solidarity during a global crisis. It is
mm.
just driven by pure commercial trade interest. So, if we are truly in favor support of developing countries and the positions that are being taken, then you need to show that publicly, right? I think a lot of the European nations are just hiding behind the European Union position.
Union. Yeah, and the onus also rests even because this is not a responsibility for the global south. The onus rests on the
Yes,
EU countries, the European powers, and even the ones that are sympathetic or I would say supportive of the global south demands. The onus also rests on them to be able to push for this to be reflected in the EU's
of
position and in the
course.
text.
Yeah,
Yes,
yeah,
so I agree with you on that. I really just want to thank you because this conversation is worth having and we will keep on having it. So there's a number of advocacy around the world that is, whether it's in terms of open letters, civil society action, or press conferences, and they're all very relevant to help us make sure that we get the world an equitable PABS annex because what is decided now will shape whether the next global health emergency is handled more fairly than COVID, where vaccine hoarding cost us an estimated 1.3 million preventable deaths. And the bottom line for us is that the PABS annex, it doesn't make sense for it to be approved if binding equity provisions are not met, because we'll just have another paper that looks very good,
exactly,
but doesn't
exactly.
deliver on the
Yeah,
promise. And so it is important that even for us, part of what we're calling on is for the EU leaders themselves to join the Global South in supporting mandatory benefit sharing, legal certainty, and real accountability. And I'd just like to end a bit by saying that the EU must align its position with the values that it champions. It champions
exactly.
solidarity,
Yeah.
it champions support. So it must
And solidarity, or always champion solidarity, but it never actually it's they talk, but they never actually show it in practice, right?
in practice. So we need the EU to walk the talk, like they will say. We
Exactly.
need them to
Yeah.
walk the talk because a strong PABS annex is not symbolic. It saves lives. So what we need the EU to do is to make sure that we have not just only a pandemic agreement, but a PABS system that delivers on its promise, that which it was intended to address not on paper, but in practice. Thank you so much, Sanjita. It's been such an honor having this conversation with you.
Thank you very much. Thank you very much.
Thanks for being part of the global public health revolution. We hope today's conversation left you inspired, challenged, and ready to shake things up. If you loved this episode, don't keep it to yourself. Subscribe, leave us a review, and share it with your network. Let's keep the momentum going.
Resonate.